Been reporting the World Health Organization has reported a record daily increase in global COVID-19 cases. They rose over 230,000 in 24 hours. The biggest increases were in the United States, Brazil, India and South Africa, powering ahead as well. The previous WHO record for new cases was around 228,000. Deaths remaining steady at the moment at around 5,000 a day. Global coronavirus cases were approaching 13 million today, marking another milestone in the spread of the disease that has killed more than 500,000 people in 7 months. We're joined now via Skype by Dr. Mary Stevens, Technical Officer at the World Health Organization's Regional Office for Africa. She's with us on Skype. Doctor, thank you very much for being with us. Let's start with South Africa, now 10th in the world and certainly leading on the African continent.
Yes, good evening and thank you for having me. We are seeing daily increase in number of cases in Africa, and of course South Africa is reporting the highest number of cases. But we have also noted the efforts put in place by the South African government to curb the spread of this outbreak right from the beginning of the outbreak. So although we are seeing increasing number of cases, but experience from other countries shows that once we expand most of the public health measures, and of course sometimes we have to impose back the lockdown, especially on hotspot areas, then we will manage to curb further spread of the outbreak.
Yeah. Does it surprise you that South Africa is so far in the lead? I guess it makes sense. We have travelers coming in and out. That's how the virus first got here.
Yes, so for South Africa, it's not surprising because at the beginning of the outbreak, of course, you had quite a number of imported cases. So you will see this kind of scenario anywhere in the world. But like I said earlier, also the effort put in place by the government is commendable. What we need to do is to make sure that we focus right now on the hotspots, making sure that we are expanding all the capacities for detection, contact tracing, for isolation, for testing, and also the population, making sure that they observe the preventive measures, wearing their face masks, hand hygiene, respiratory etiquette, and making sure that they stay at home if they don't need to go outside. The government might have to look at the situation and make a difficult decision. So meaning that there might be a situation where they will have to impose the lockdown on some of those hotspots to curb further spread.
Yeah. Well, do you have any advice? I mean, this is something that the president has had to grapple with. He will be addressing the nation tonight. Some calling for stricter lockdown measures, many others saying that we simply cannot afford it in a country with our jobless rates, poverty rates, etc.
Yes, so in outbreak response, sometimes we have to make difficult decisions. In addition to expanding all the capacities we talked about, making sure that it is decentralized to all levels of the health system, imposing lockdown in selected areas, especially in hotspots, it's going to go a long way in helping to curb the further spread of the outbreak, because we have seen it work in other countries, and we have seen the lifting of lockdown in the US, in Brazil, leading to increase in number of cases. So basically we have to make that difficult decision and looking at how we can balance up those people that will need some support, especially in terms of feeding the poor and vulnerable in the population, because we need to curb the spread, and of course we want to maintain the livelihood. So the government has to take some difficult decisions here.
Very tricky. Then, Doctor, tell us where the other problem areas are on the continent. Egypt, numbers also ticking up. And which are the countries you're really worried about? I mean, let's put this in perspective. There are concerns about South Africa's healthcare capacity. But in terms of other countries on the continent, they could be faring much worse when those numbers spike.
Yes, so just to say that in South Africa, although you have the highest number of cases, the capacity we have, I mean, in terms of health system in South Africa, is much more stronger than what you have in other parts of Africa. So just imagine these cases in South Africa happening in one of those countries where we have weak health systems. It's going to be a complete disaster. But somehow South Africa has been able to navigate too, because for the simple reason you have better health system than most countries in Africa. We have other countries reporting increasing number of cases. Nigeria is one of them. Egypt is one of them. Ghana. So these countries are beginning to report additional number of cases as well. And of course, what we are worried about is the capacity of the health system to cope with this increasing number of cases. And we need the general population, because there has been this misunderstanding among the general population. I don't know whether it is happening in South Africa, but in countries like Nigeria and Ghana, some people don't even think that COVID-19 is real. They don't think it exists. So that communication to the community to make sure that they also observe the preventive measures is also very, very important, in addition to the public health measures.
A huge issue. Final question, Dr. Stephen. There has been predictions. There have been predictions that ultimately Africa, parts of Africa, will become the epicenter of this virus. It's just a matter of time. When do you think that will happen?
For me, I think predictions are good, but we can prevent the prediction from happening by making sure that we expand the capacities for testing, for detection, for treatment, for isolation, contact tracing, and like I said, the preventive measures by the population. There has been a lot of prediction about Africa, but it hasn't come to pass. This is because of the effort put in place by governments in Africa to cope further spread of the outbreak. So we can actually prevent Africa from being the next epicenter by ensuring that we ramp up all the public health measures, some of the social measures in all our countries, so that we can limit and cope further spread of this outbreak on the continent.
Indeed, hopefully those predictions don't come true. Thank you so much for that information tonight, Dr. Mary Stephen, Technical Officer at the WHO Regional Office for Africa.